Greetings, everyone. It is with great pleasure that I extend a warm welcome to our esteemed guests and participants attending the Asia Colloquia Progress in Policy series. This series is dedicated to discussing the most pressing policy issues in South and Southeast Asia. The Colloquia is organized by the Advanced Study Institute of Asia. We are an interdisciplinary and autonomous research center affiliated with SGT University in India. Our research covers South and Southeast Asia's political, economic, health, and security domains. Our products include Sense Maker Conversations, bi-weekly newsletter Decipher, weekly newsletter Read IP Wave, and other academic publications. I would also like to extend my gratitude to our esteemed organizing partner, the Institute of the New Economic Thinking Young Scholars Initiative. This progress and policy colloquia on addressing lead poisoning in South Asian countries aims to bring together experts, stakeholders, and policymakers from different countries in Asia to discuss the current state of lead poisoning research, policy frameworks, and prevention strategies. The colloquia aims to serve as a platform for knowledge sharing, policy dialogue, and collective action to address the critical issue of lead poisoning in India and South Asia. The goal is to identify gaps and limitations in existing policies and research and to propose recommendations for strengthening the policy framework and research agenda on lead poisoning. The colloquia today is divided into two panel sessions, both are 90 minutes long. In the first session, we have a panel of three speakers and a chair. Each panelist has been allocated 20 minutes to share their work. After the presentations, we will have a 10 minutes of question answers session. We'll encourage the participants to post their questions in the chat at any time. The moderator at the end of the session will collect them for the panel to answer it. If you require any technical assistance, please contact us via the chat box. The name of the first panel session is Evidence-Based Assessment and Policy Interventions. In this session, we will discuss evidence and research to understand the extent and impact of lead poisoning in South Asia, as well as discussing the potential policy interventions to address and prevent the issue. Now, I welcome my colleague, Ms. Shipra Agarwal, to moderate the session.
Thank you for a kind introduction, Neeti. A very good morning to you all. It's my privilege to moderate our inaugural plenary session on evidence-based assessment and policy interventions. We have assembled a distinguished panel of experts who will share their insights on addressing the critical issue of lead poisoning in South Asia. Their contributions will inform our discussions and help shape our evidence-based policies and interventions to tackle the pressing concern. Before we start, I want to make an announcement that the Advanced Study Institute of Asia has prepared a working document titled No Safe Bloodlet Levels, Understanding Thresholds, Compliance and Legal Consequences. It's a handbook that provides an overview of the laws and regulations surrounding lead exposure, including the various thresholds and standards that exist. The document acknowledges that there is no safe level of lead exposure, and yet compliance with these regulations remains a significant challenge. This working paper version 1 serves as an initial document by Asia for their ongoing efforts to address the issue of lead poisoning in South Asia. We have already shared it with the experts to facilitate review and suggestions that will help shape and strengthen the document further. Once Asia has received and incorporated the expert feedback, they plan to make the document publicly available. Now, first and foremost, I extend a warm welcome to our chair, Dr. Indu Bhushan. Dr. Indu Bhushan, a former Indian bureaucrat and economist, served as the first CEO of Ayushman Bharat, India's national healthcare coverage program. Prior to his role at Ayushman Bharat, he held various positions as an IAS officer and appointments at the World Bank and the Asian Development Bank. Dr. Bhushan's contributions to the medical field have been widely recognized. In 2020, he received prestigious Global Achievement Award from the Johns Hopkins University Alumni Association. Currently, Dr. Bhushan chairs the Indian Working Group on Lead Poisoning and leads the India Lead Elimination Action Project initiative by Pehle India Foundation, bringing together stakeholders and conducting research and developing policy recommendations to address lead poisoning in India. He is also a vice chairman of Asia. Now, please join me in welcoming our esteemed panel. First, we have Mr. Satish Sinha, the Associate Director at Toxic Link, an Indian non-profit organization dedicated to environmental issues. Mr. Sinha has been associated with Toxic Links since around 2003, working to address environmental challenges related to waste management, particularly electronic waste. Through his leadership at Toxic Link, they have conducted research and advocacy to raise awareness about lead poisoning and push for stricter regulations on lead in products like paints, toys, and food packaging. The organization has also worked with communities to test for lead contamination and provide education on lead safety. Prior to his work at Toxic Link, Mr. Sinha has experience as an environmental specialist, and his contributions have helped shape the discourse and approach to these critical environmental issues in the country. Today, Mr. Sinha will discuss on lead paint regulations in India and approaches to improve compliance for public health protection. Now, I would like to invite our next panelist. We have Mr. Bjorn Larsen, an experienced international development economist and consultant with over 30 years of professional experience. Mr. Bjorn Larsen has worked extensively across Asia and various other regions, providing consultant services to a wide range of clients, including World Bank, international development agencies, the private sector, and the research institutions. Larsen's areas of research and interest over the last decades have included economic assessment and cost benefit analysis of environmental health issues such as air pollution, water sanitation and hygiene, and lead and arsenic exposure. Over the 20 years as a consultant, Mr. Larsen has prepared over 100 research papers and policy reports and has 25 publications in professional journals and books. Mr. Larsen will present on addressing lead exposure in South Asia through evidence-based policy. Finally, we have Jeiel Guarino. He is Global Lead Paint Elimination Campaigner at IPEN, a global network of over 500 non-governmental organizations working for toxic-free future. In the role, he leads IPEN's efforts to eliminate lead paint worldwide. He has worked with governments, industry, and civil society in over 50 countries to establish lead paint laws and regulations, provide the availability of affordable lead paint-free alternatives. Under his leadership, IPEN established the Lead Safe Paint certification program to verify paints contains less than 90 parts per million total lead, the strictest regulatory limit. His efforts have contributed to the growing global momentum to eliminate lead paint, with several countries in Asia and Pacific region establishing legal binding regulations on content in paint because of his advocacy and awareness efforts. Today, Mr. Guarino will focus on how a Rotterdam Convention listing can accelerate global lead paint elimination. Now, I want to invite our chair, Dr. Indu Bhushan sir, to deliver remarks from the chair.
Thank you very much, Shipra, and thank you, Professor Amog, for organizing this. I say that because lead poisoning is a public health challenge which is almost invisible, and more we can do to bring it out in public domain and raise the profile of this challenge, I think we are doing some service to the country and the region. So thank you very much again for doing this. As a chair of working group, India working group on lead poisoning, we have been undertaking several initiatives, including going around in different states. We organize roundtables where we invite government functionaries, academia, civil society, and many others. And in all of these state roundtables, about 30 to 35 people have joined. And when we discuss this at the state level in India, we find two things which are common in states like Assam to Orissa to Madhya Pradesh to Chhattisgarh, is that all the government officials, they are shocked when they hear about it because they have never heard about lead poisoning. They've never thought that lead poisoning is a public health challenge. The same reaction I've got from when I've discussed this with the Health Secretary of Government of India or Health Minister, because they thought that lead poisoning was not a major challenge. Second thing we have seen is that at the state level and the micro level, there is a lot of research which is there on lead poisoning, which shows that this problem is known to researchers and academicians, but it has not come out in the policy domain. So this seminar that you have organized actually is a very useful step in terms of bringing out research and sharing that with the general public and also policymakers. Uh, we know three things which there are many things about lead poisoning that we don't know, but the three things that we know for sure. One, that prevalence of lead poisoning in India is quite high. It could be 50%, 60%, 70% in terms of children having more than acceptable level of lead in their blood and bones. We don't know the exact number, but we know that it's quite high and it's unacceptably high. And so that's we know for sure. Second thing that we know for sure by all the research which has been done worldwide, that high level of lead in blood and bones has adverse uh, development outcomes, especially for children. We know that if the blood level is high in the blood of pregnant women, that leads to high blood level among newborn children because lead travels through placenta, and we have research to show that the birth outcomes are also adverse. There's a correlation between lead levels in pregnant women and low birth weight babies. Their length is smaller, their head circumference is smaller. And also, if the lead levels among children are high, then we've seen that education outcomes are also adverse. And the research will show that we are losing a lot of intellectual power and IQ because of this lead issue. So that's also known that number one, we have a high level of lead in our population. Number two, that because of that, we are losing out on our vision of achieving demographic dividend that we call. So third thing also, which is also heartening to know, is that if we decide to address the issue of lead poisoning, we can do it quite easily. And we've seen from the experience of Bangladesh, where they found out that one of the major causes of lead poisoning was turmeric, which is used in everyday cooking. And once they focused on reducing that that lead levels in turmeric, uh, within 2 years, there were significant reduction in the blood lead levels in the population. And we've seen similar kind of very positive results from other countries as well. So once there is a policy attention, there's a seriousness, this can be very easily achieved. So with that, I again thank Asia Group and also Professor Amog Rai personally for organizing this. And I look forward to um, listening from many of the panelists, and I have heard about all of them, and looking forward to their insights and guidance for future in the region. Thank you.
Thank you, sir, for chairing the session and setting a stage for the panelists. Now, let us begin with Mr. Satish Sinha's presentation. Over to you, sir.
Thank you very much. And thank you to all fellow panelists and other people who are on the web. Can I have my presentation? Thank you. Next, please. So I thank you for the introduction to Shipra. And
Thank you, sir.
as mentioned, I am part of Toxics Link, and we have had a long history of working on lead. Especially one issue has been lead in paints, which I will speak today. And Jeiel is my other counterpart panelist. We both represent IPEN here. IPEN has been very, very actively involved in this issue of eliminating lead from paints or carrying a standard for lead in paints. So that's about toxic link. Next slide, please. So talking about lead, especially a overview from India as to what is the lead status in India, I just wanted to put out some figures and some data. We have consumed, we're quite a significant consumer of lead. We consume about 1.38 million metric tons in 2022. This is quite significantly high as compared to 0.96 millions in 2017. Whereas if you see the production figures of India, it is just the largest producer, sixth largest producer in 22. So we are the sixth largest producer, and you have some of the biggest mines in the state of Rajasthan. So we do have this, and we we mine this metal and we refine it here in India with an annual production of 3.88. Also, there is an important point to understand that estimated to have decreased from 242 in 23. The point that I'm trying to make is that while we have production of lead and we have consumption of lead, we are grossly deficient of lead. Our consumption is much higher than our production figures, and that is the reason why India is the world's largest importer of lead waste. Now, that's significant to note because when you're going to import lead waste, you have to refine it and you have to get that into into consumption, into production state. So that is a significant area that we need to understand that part of it. Next slide, please. These are some of the usage of lead that we all know. The biggest one, perhaps to my mind, has been the lead acid battery. That is something we all of us know. And when the batteries are end of life, they are supposed to be taken back, or they are expected to be taken back by the OEMs, the manufacturers, as per the EPR policy, and they are expected to be recycled in a manner that it causes least environmental damage. Well, does it happen or not? That's a separate question. But the laws are there, the understanding is there, and this is what it is. There are other kinds of usage. Use plastic is another bigger use. Uh, then there is electronics and electrical goods, other industrial processes that you have. Then you have toys and jewelry. All these use pottery, ceramics. All these are large sectors where lead is used. Automobile, this is another sector where lead is quite extensively used. Now, so wherever you have uses, next slide, please, you're likely to have, and if your systems are not efficient enough, you're likely to have emissions and you're likely to cause lead exposure to workers and to other people who are in and around that area. Lead is a naturally occurring substance in our Earth's crust, and as I mentioned, that we have lead in India too, and we do mine and get lead out from there. But the downside of lead is also that it's one of the highly most toxic metals that is known to humankind. Other than mercury, lead is another toxic element. uh, it is both neuro and nephrotoxic. I think we need to understand that it is both neuro and nephrotoxic. It affects one of the major issues of lead is that affects the nervous system, and children are most vulnerable. They get impacted most, and it causes a loss of IQ, and it also results in your loss of productivity and GDP. And the last point that I want to mention, that the impacts of lead or health impacts of lead are non-reversible. They can't be reversed back. So that is something to be kept borne in mind, that sometimes when lead affects your IQ levels and your nervous system, you need to be careful about it. Next slide, please. These are some other areas of parts of body or organs which are likely to be affected: brain, muscle, then your digestive system, your kidneys are likely to be impacted. That's why we mentioned is nephrotoxic also, and the other parts of the body that get impacted because of lead poisoning. There are different levels of poisoning, and somebody was just mentioning that I think Bjorn was mentioning that the Indian children have been there is a data to say that it's 5 microgram per deciliter. which is obviously there is no safe level for lead in human body, and we should have no lead levels. But if it is high, there have been other studies also much before I remember. When we had lead in gasoline, also there were studies which were carried out in India, and they were done with children. There have been other recent studies also, which do give you similar kind of data. So I think the data set is quite okay as far as I understand that. And because if I recollect, the lead in gasoline and other times when the lead was exposure was much higher, so you had similar kind of data. But if lead has been removed from gasoline, then the real question is, where does the exposure happen from? Okay, next slide please. So, as an organization, we started working on lead in paints. I'm going to talk about lead in paints because that's something that we have done in India and in the neighborhood. So, we like to talk about lead in paints and how it happened. Uh, in 2006, we started to work on chemicals in products. That was the basic framework on which we were working. And we were looking at multiple chemicals which are there in products. And one of the things that we picked up was children's toys, because that was something that we had some previous history of trying to find out that there were some amount of chemicals in toys. So we checked up toys in 2006, and we found that less lead concentration in toys were very high. And we picked up all kinds of toys, which are branded, non-branded, local markets, everything that we picked up, and we found that is very high. The range is given here is from it ranged from it is almost went up to 2105 ppm, which is extremely high. So when we started talking to the toy manufacturer, we said, why do you add so much of lead to it? Where does it come from? So, well, plastic was another source of lead contamination, but they said the real contaminant is not the plastic, but look at the paint part of it. We said, oh, we didn't know about it. So then we looked at paint. Then we tested paint in 2007, and to our surprise, all branded paints and non-branded paints, we had lead in it, and they were using this paint for the manufacturing of toys across the country. The amount that we found in the paints, you can see the figure, is just absolutely amazing as to how you could have so much of lead into it. But this was the first report in India that we did in 2007, which gave you this kind of a data. Next slide, please. So this is the range of campaign that we do. And so we started in 2006 with lead in toys, then we did 2007, then we do it again in 2008, 9, and we continued till about the last report has been in 22 also, 19 and 22 again. So we have had a series of this. So, and we found that lead levels were going up always. In 2006, I think 2006 or 7, uh, India, well, as part of SICEM, there was lead in paints was an emerging issue in the Strategic Alliance for Chemicals Management. So this became an emerging issue in 2006. And prior to that, as part of Toxic Link and IPEN, we had raised this issue, raised a resolution in the IFCS forum, and it got accepted as a global contaminant, and it had to be and lead in paints. We raised the issue about lead in paints, and it was accepted, and it came up in the SICEM issue. So we also worked across the region, Nepal, Bangladesh, Sri Lanka. We tested their products also, because some of the manufacturers in India were exporting to Sri Lanka, were exporting to Nepal, and were exporting to Bangladesh. So we tested samples from these countries also. So, and we started this dialogue with the paint manufacturers and built up this campaign across the India. So by 2010, 2011, many of these branded manufacturer started shift. I'll tell you the story behind it. And then when we worked with IPEN as a larger network, and we did it in whole of Southeast Asia, and then we had much better results across whole of South Asia. And as far as India is concerned, finally all the campaign that we did, it led to came to a policy and a regulation of reducing the lead content in paints. It is not zero, but there is a policy which says that no added lead in paint, and the background levels of lead cannot exceed 90 ppm. That is the standard for lead in paints in India. So next slide. So what we did, what was the campaign strategy that we were testing the paints which are available in the market, and all brands, both branded and non-branded. We were testing it out and putting out the results, but at no point of time we named any brand in these results, in these reports, because there was a danger of getting into a legal hurdle with the paint companies, and so we avoided it. But fact remained that we talked to citizens and consumers and everybody else, all the stakeholders, and they saw the point that we were trying to make, and they saw the issue rather than look at which brand was okay and which brand was not so okay. So we created awareness among consumers, children, teachers, parents, and doctors. It is, I think, it is important to. I'll make this point very, very clearly. Most pediatricians in India came to our meetings, and they were fully aware of lead poison or lead exposure to children. It is that during this time, between 2006 and 2009, India was not able to even test blood lead level at that point of time. And so pediatrician, if they had any doubt or any case to be diagnosed, they found it extremely difficult. So the only lab that was doing, as far as I know, in Delhi was Shriram lab in Delhi, who was doing lead level testing in those days. Then I recall that Lal Path Lab came with the test protocol for lead levels. And then many other labs have been doing the lead level testing in their labs. So it was in during those days that this happened, and lead testing was available to many people now, many patients. Uh, no, can we go back to the slide? Yeah. So we published the results, and this is how we built a campaign. And we spoke to schools, we spoke to teachers, we spoke to parents, we spoke to consumer groups, and they were all extremely happy to participate in this campaign. And we went across the country, various states and various places where we talked about lead in paints, and everybody was extremely receptive. And in fact, I would like to point out, even the paint industry was part of the discussion, and they found it difficult to uh, deny this or to say that yes, it does not cause a problem. So we tested paints in the houses, we tested dust in the houses, and we found that lead was available in the dust in the houses also, because the paints flake and they fall and they contaminate the soil on the ground. Okay, so media was another big support in doing this, and children health is emotional issue. So most parents were very much on board. They used to call us up, they used to ask us, tell us what to do, how do we help you out, and that was how the pressure was built on the paint industry to look for alternatives. Well, they always said that we don't have the alternate to the pigments that are made. They cannot be made in India, and we have to import it. So there's a cost to it. Next slide, please. Okay. And it was this during this time between 2006 and 9 that the SciChem happened, and India became a part, and it was an emerging issue in SciChem. And we also had the Gallup Global Alliance for Lead Elimination. So all these strengthened our campaign, and they pushed the paint industry to look for a substitute to lead based pigments. And we also, I must point out that the Bureau of Indian Standards had a voluntary had a standard of 1000 ppm in those days. They also revised the standard for lead in paints to 90 ppm during 910. I think they revised, no, 2013 they revised the standard to 90 ppm. So all this helped push our campaign, and it was after that that the government of India decided to look at the lead standards, and they came up with a standard of 90 ppm in 2016, which got announced in 2016 and became effective in 2017. So CPCB, the Central Pollution Control Board, is the agency which is supposed to monitor it and it's supposed to implement it. And today, the Global Alliance has been working, and we have 84 countries where they have removed lead from paints, one of the major contaminants and source to children's exposure to lead. So that is the story about lead in paints. And today, most, I would say that almost all branded paints, all in India are, they adhere to this standard, they comply to the standard of 90 ppm. It is only some of the smaller brands and non-branded SME sector which is not following these norms. Well, many of them have shifted in the SME sector also, but when we do carry out tests for non-branded paints, we do find violations of this. Next, please. And we have been conducting tests for non-branded paints 2019 and again I think in 2022. So you can see that results are there on the screen to for everyone to see that again there is violation and non-compliance of this. We have taken up this matter with the Central Pollution Control Board, and uh, I think the problem is there is no, there's very little surveillance mechanism to paint from the non-branded. Many of these paints, but what we found was that they say that no added lead, but they don't meet the norms of the 90 ppm. So that is what is the story about lead in paints. Next slide, please. So as far as lead, possible sources of contamination or exposure, I think there have been reports that the water has been another source of carrying lead. The lead content in drinking water is coming up to be slightly higher than what is globally permissible and what is nationally permissible. And perhaps the reason is the PVC pipes, which are required for supplying of water in the domestic areas, and even from the supply lines or from storage plants to the domestic households levels. So there is a report by Quality Council of India, which have carried out some quite significant amount of testing of water samples, and they are reporting high levels of lead in drinking water samples. So that is a point of worry, and we do understand that that needs to be looked at very, very carefully. So some of the standards that have come now have been announced by the Central Pollution Control Board are in accordance with almost the global standards that we look at it. The question is only that how do we uh, implement this and how do we comply with these standards? Next slide, please. So I think the problem that I'm talking about lead in paint especially and to other places also is about two or three places that I'll just like to mention. It's not only informal recycling of lead, it is also about formal recycling, how compliant they are, how good the formal recycling processes in India is, and how is the informal waste recycling that happens, how is lead smelting done, and what are the kind of checks and balances that are there. As regards to paints, I would say that enforcement of regulatory framework, not many health studies in India, very few, very few. In fact, if you, to be honest with you, if I share my personal experience, if you go down to lead recycling areas and look at the workers who are working with lead recycling, you'll be surprised to see the lead levels in them. I know people who do have acute poisoning. Their levels can be as high as I don't want to mention it here, but there are certain people who are working on this. But I know in even in Delhi that the blood lead levels are extremely high, and they get, they fall sick, they go to some doctors, they get some treatment, and they come out. Now I'm talking about adults. So you have serious issues about lead recycling. Um, and environmental costs are often ignored because we don't understand this issue so much. That's got a long-term cost. It has some of the impacts are irreversible. So you're looking at a larger population which can be a little more, which should have been a little more productive, but is not getting to be as productive as it is expected to be. So it is a serious issue about what challenges does a nation have. Low awareness and information about lead poisoning and what are the sources. And I think we need also to talk about regular monitoring of it. So I think these are some of the issues that I thought I could flag out in this short 20-minute presentation. Thank you very much.
Thank you so much, Mr. Sinha, for sticking to your time and for your insightful and thought-provoking address on the critical challenges and way forward for improving land management in India. Now, I want to invite Mr. Bjorn Larsen to present. Thank you.
Good morning. Good morning. Thank you for that presentation. That was very informative and very interesting to hear the history of how you have made so much progress on, eliminating lead in paint in India. Um, so, my presentation, the title I was given, and that I will try to follow, is addressing lead exposure in South Asia through evidence-based policies. So we have to ask then the question: what is the evidence? Evidence of what? So I'm looking a bit here at in this presentation on population exposure. What do we know about the exposure? Primarily blood lead level data, blood lead levels. What are the major health effects? I think these are very clear, but we'll also show some new research on this. And the area, I think, we know a lot about the sources. We know a lot of sources of lead, but we don't know so much about how each of these sources actually contribute to blood lead levels and how that varies across regions, sub-regions, nationally, subnationally. And then I'll present a bit on some new cost benefit analysis we have done for some interventions to reduce lead exposure. And then we'll talk about, well, what are some of the policies that are needed? Next, please. Here we see some data for 2021. These data are from the Global Burden of Disease 2021 that was just released maybe about a week ago. These are the best estimates they come up with. This is the most global data set available. Is based on all identified lead level measurement studies around the world, and combine that with modeling, their understanding of various factors that influence the blood lead levels. So that also involves modeling. So we see here these blood lead levels in children under 5, 2021. And we see here by region in low and middle income countries. Sorry, I'm going to need to switch to my own here. Okay, so we see in low and middle income countries all the way to the left that the blood lead level is about 6 microgram per deciliter. And that's a lot. That's really a lot. So, and South Asia, you see South Asia, Sub-Saharan Africa, Middle East, North Africa, these are all low and middle income countries. The levels are even higher at about 7 microgram per DL. To the right, we see each of the South Asian countries, the 8 countries that I normally see as classified as South Asian countries. We see the level in Afghanistan is very, very high. Bangladesh, India, Bhutan, Pakistan are about at the average of South Asia, average of low and middle income countries. Nepal higher, and then much lower in Sri Lanka and Maldives. Now, we need to remember that these are just the best effort estimates of blood lead levels. There is very much a lack of nationally representative blood lead level measurement studies. Most of the studies have been done in small samples, in particular areas. So these estimates here, of course, they try to screen out the high exposures, right? Occupational exposures, etc. So the studies they're relying on to come up with these estimates are really based on what they think are blood lead levels in the general population. But we really need more representative blood lead level measurements at the national level and subnational level. Next, please. Okay, so here what we see, I wanna give some attention to this. You may remember that in 2013, Athena and Trasanda published a study of IQ losses in low and middle income countries. We did the same last year, and we find actually that the IQ losses, according to our estimate, is about 80% higher than Athena and Trasanda estimated. Now, this is even at lower blood lead levels that we used. The blood lead level data we used are lower than they used. So the main reason for this is the evolving understanding of how relatively low or even very low blood lead levels are really affecting the neurodevelopment of children and causing, impairments and IQ losses. So we get very scary figures, and about a third of these losses are in South Asia. Now, what does this mean? So if we look to the right there, you see the estimate of lost IQ points per child in the first 5 years of life across the South Asian countries. So around 6, 7 IQ points are lost. Now, per child. Is that a lot? Yes, it is a lot, of course. The average IQ is about 100. And if these losses are across the children population, actually what it means is that we are losing half of the population with an IQ over 120. So let's say all these, intelligent people, we are losing half of them because of this lead exposure. So that may be very severe in terms of economic development, innovation, and productivity, and so on, right? So it's a very, very, very alarming situation, I would say. Next, please. Now, IQ loss is not the only adverse effect in children, as was mentioned in the previous presentation too, or in the introduction. It has effect on, it causes adverse birth outcomes associated with stunting and many behavioral effects and other cognitive impacts than IQ. And all of these, in fact, are contributing to compromised schooling and learning, labor force participation, and earnings, and eventually, ultimately lifetime income. All of them, the stunting, the birth outcomes, the other cognitive impacts. So the estimates that we have is just for IQ, which is the easiest to estimate. Next, please. Now, children are not the only ones affected. There are substantial cardiovascular disease mortality from lead exposure. And I would like to point to 2 relevant publications in this respect. Last year, the American Heart Association published an article, a scientific statement, stating that, that the mounting evidence points to lead, arsenic, cadmium of being substantial cardiovascular disease risk factors. So this is very important. This is very, very important that actually a medical association comes out with this statement of this recognition. This is quite new, although, there have been lots of studies over time, of course, have demonstrated evidence, but now finally, a big, important association has come out with this statement. The study to the right is by ourselves, and what we estimated is that there's far more cardiovascular disease effects and mortality than previously reported. Next, please. So what Global Burden of Disease has presented now for 2021, just a week ago, is that there are globally about 1.5 million cardiovascular disease deaths from lead exposure, of which nearly 0.4 million in South Asia. Now, our estimates indicate that no, it's not 1.5, it's 5.5 million. So about 3.5 or more than 3.5 times more. And in South Asia alone, about 1.4 million. In perspective, this means that lead exposure is causing 30% of all cardiovascular disease mortality. Yeah. And you see in the chart there the difference in mortality per 100,000 population, the difference in our, no, don't change, please. Go back to the old one, please. Yeah. You see in this chart here that the difference between our estimate and the estimate by global burden of disease. Now, why such a big difference in these two estimates? The reason is the following, that the global burden of disease, the methodology that they use, only captures the effect of lead on blood pressure. This is known for a long time that lead exposure causes elevated blood pressure. And in turn, elevated blood pressure causes cardiovascular disease and cardiovascular disease mortality. What we did, we used research literature that captures the broader effects on the cardiovascular disease system. And these broader effects are explained in that scientific statement that I pointed to by the American Heart Association. So lead affects the cardiovascular system much broader than just through higher blood pressure. It affects the arteries, clogging up arteries. It affects the heart. So it's causing much more mortality than previously estimated. So this is very significant. We don't claim that this is the final number and that this is necessarily the most accurate number, but it provides a whole new perspective, and it makes sense because we are capturing these broader effects. Next, please. So we have put some cost figure on the IQ losses as well as the early mortality, cardiovascular disease mortality from lead exposure. And the figure we came up with for 2019 in one single year is $10 trillion. These dollars has an I in front of them, so they are purchasing power parity adjusted dollars. And it's equivalent to 7.8% of GDP in magnitude. It doesn't mean that GDP has declined by it in any way. It's just to present it as to understand the magnitude of these costs. $10 trillion. Next, please. So now, the effect of lead exposure on cardiovascular disease is important, not just in terms of the sheer number, that scary big number of 5.5 million, but also because low and middle income countries has been going through a transition from communicable to non-communicable diseases. So if we go back to 1990, we see that communicable diseases and non-communicable diseases amounted to about the same number of deaths per year. But then since then, in a 30-year period, communicable maternal, neonatal, nutritional causes of death have declined by 60%. So huge progress there. But for non-communicable diseases, of which cardiovascular disease is almost a half, has in fact increased. But very, very little has been done about it. And I will show you a slide later how little money actually is poured into that area. So we need to address these, we need to come to a clear understanding of these environmental factors, including lead, that is causing a lot of cardiovascular disease mortality and other non-communicable disease mortality, like chronic respiratory disease and so on, cancer. Next, please. let's take a look at the sources. So we were informed of the lead in paint as one. So I put this under consumer products. So it could be cookware, paints, cosmetics, toys, spices, I guess you could call it a food, but medicines. Drinking water was mentioned. It could be lead pipes. It could be other pipes that contains lead. Soil and dust, both in the house environment as well as residential, just outside the house or schoolyards, wherever children spend their time. Tobacco smoking is another one, and secondhand smoking is another source of lead exposure. Food, and food is not very often mentioned, but we'll talk a little bit about that in the next couple of slides. Food in some countries could be a significant source. Fertilizers, lead in fertilizers. In commercial fish feed, there are studies shown high correlation between lead in fish feed and lead in farmed fish. The ULAB recycling, of course, is something needs to pay a lot of attention to. And then occupational exposure, of course, from ULABs, jewelry making, e-waste, mining, others, and other sources of lead. So we know that there are a lot of sources. Next, please. But we don't know so much about how each of these sources is contributing to blood lead levels across countries and within countries. Now, here we see a slide. This is from a recent lead assessment in over 5,000 products in 25 countries conducted by Pure Earth last year. It included 4 countries in South Asia, not nationally in India. It's only from 3 states, Maharashtra, Tamil Nadu, and Uttar Pradesh, I think. So what did they find? This shows you the percent of the sampled items with lead levels above a reference level. And the reference level, for example, for paint was 90 ppm. Of course, for other products, they used standards and so on that they found and for other countries and organizations. And basically, the result is this, that 72% of metallic foodware, they call it. It's basically pots and pans used for cooking. 72% contained lead above, I think, 100 ppm. And 34% of ceramic foodware contained lead above a certain threshold level, reference level. These were the 2 most frequently, let's say, violating a reference level, plus paint, including in India. And then we had cosmetics, plastics, toys. Spices was found to be low, and in part because in Bangladesh, as was mentioned, lead was removed from turmeric in Bangladesh just recently, with very, very successfully. So the main thing that stands out from this chart here is really the metallic foodware, the ceramics, foodware, and paint. Next, please. But even then, even with this knowledge, one still have very little knowledge of what is the contribution of each of these sources to blood lead level. You see? So this is the trick now. So I'm putting some points here, okay? A lot is known about the individual sources of lead. We know these sources, but much less is known about how they contribute to blood lead levels. And this is a knowledge gap that prevents the development of not only cost-effective policies, but effective policies. Where should we put our efforts to get the biggest results? And hopefully also at reasonably at the lowest cost, right? We want to achieve that. We have limited resources. We want to achieve this at the lowest cost, and we want to be as effective as possible. So we have to fill some of these gaps. So, for example, there have been lots of studies on lead contamination in aluminum cookware. It's mainly recycled aluminum. And there's just such a variability of how much lead there is in the aluminum, how much lead actually seeps out into the food, depending also on the type of food being cooked, and how much this is affecting blood lead levels. So here there is a fair amount of work that needs to be done. It's an important area to research further. Pure Earth has some activities here, and it's going to be interesting to see what comes up. Now, lead in food. So there was a paper a couple of years ago with just a review paper of studies of lead in food. And they definitely raised a red flag that this could be a major issue in many countries, not necessarily nationally, but it could be parts. In Bangladesh, that is so densely populated, it seems to be an issue. Lead has somehow is contaminating agricultural soils. And there are dozens of small studies have suggested that, hey, this is a problem. But none of them are really large, and there's just a variability. So none of them are really large enough to be conclusive. So there's work that needs to be done there. Next, please. So I want to give you a sense of, okay. Is that the first one? Or was it the aluminum one? Okay, here we go. So I want to give you a sense of what could it mean, this lead contamination in aluminum cookware? What could it mean for blood lead levels? So we see that there have been lots of studies, no doubt about that. And some studies have even found that as much as 260 microgram of lead has been released into the food, into 250 milliliter food serving. Okay, that's very, very high. Others find that no, nothing gets into the food. Some aluminum cookware doesn't contain any lead, but it is a big issue that needs to be figured out. Now, so if you look at the chart here, you see that it doesn't take much lead per serving, right, to really cause a huge elevation of blood lead levels. So we said that some studies have found up to 260, but if we take, let's say, 50, for example, we see that blood lead levels will be about 8 microgram per DL. This is in a 2-year-old child, okay? For adults, it's going to be different because, because of weight and metabolism and various factors. But we see here that it doesn't take that much on a daily basis. If a household cooks with lead-contaminated aluminum pots, it doesn't take much before their blood lead level starts getting quite elevated. Next, please. Here we see the same thing for food. So in Bangladesh, many studies have found that lead in fish, vegetables, and rice, they have found concentrations up to 0.5 milligram per kilo of a food item, and even much higher than that, in fact. Now, I want to just show you what if the food people eat, or in this case, a 2-year-old child eats, contains 0.15 milligram per kilo. We have estimated that it will elevate blood level by as much as 4.5 microgram per DL. Yeah. So food for some individuals could be the major source of elevated blood lead levels. And then another interesting thing I wanted to say is, but we need more research here. We need more studies, bigger studies that can confirm the geographic scope of the problem and the magnitude of the problem, and which food item seems to be most affected. And of course, also, where is this lead coming from? So this is, of course, not in cooked food in aluminum pots. This is food, as it's taken from the fields or from the markets. I also want to say that, when we look at blood lead levels within a community, so if we take we take one part of town, or we take one village, we see that there's such a huge variety in blood lead levels, and we wonder, why is that? You would think that most people living in clustered together would be exposed to the same sources, but no, there are great differences. And I think that knowledge may also help us realize maybe, okay, something about the sources. For example, if it's true that, for example, two households, one cooking with lead contaminated cookware and one without contamination, there would be big difference in blood level just from that. Next, please. I'm almost done, I think. Next, please. So I wanna show you something, because I've raised a lot of complex issues, but I also want to show you something that, this is work we have done, and this is the limited set of interventions we have had data from. But look at these benefit cost ratios of these interventions to reduce lead exposure.
I'm sorry to interrupt you, but I'm afraid we need to move on to stay on schedule. Could you please wrap it up in 1 minute?
Will do.
Okay.
So here we see the interventions. No time to go in detail here, but you see that there are plenty of interventions where the benefits are just so many more times the cost. And that's very, very encouraging. We're talking about into the hundreds for some of these, where the benefits are hundreds of times bigger than the cost of intervention. So that's very, very encouraging. Next, please. This is just recent work we have done. Policies. So we need to institutionalize representative blood level measurements. We need to do much more on source identification and understanding how each source is contributing to blood lead levels. We need to include measurements of food, and we need the samples of these home-based assessments to be large enough so we can actually get some statistically significant estimates of each contribution of source. Next, please. We need to better understand aluminum cookware, and we need to deal with the U-labs. We need to develop financial incentives mechanisms to direct U-labs to certified recycling facilities, hoping we can shut down all the illegal ones. Let's say in Bangladesh, for example, where there are over 1,000 of them, is a long shot. We need to provide incentives, make sure batteries get where they are supposed to go. And then we can do something in terms of primary healthcare. This was touched upon, let's say pregnant women. If pregnant women are identified at high blood lead levels, we need to do something. We need to start immediately to do something to prevent that she continues like that, and also that the child ends up with high blood lead levels. Next, please. So here, this is interesting. So this is in relation to what I said about non-communicable diseases. So if we look at what the global community has contributed in terms of assistance for health to low and middle income countries, we see that about 98% of it is to communicable diseases and so on. Only a couple of percent to non-communicable diseases, which is on the rise. These diseases are on the rise, but receives almost no money. So this is also something that has to be changed by huge development institutions. We have to recognize that this is where money needs to be channeled more, and that environmental factors plays a major role in the cause of non-communicable diseases, including lead. Sorry for going over time. That was even more, but thank you very much. That ends my presentation.
Thank you, Mr. Larsen, for that insightful and informative presentation. The data you have shared on the devastating effects of lead poisoning, and including the IQ loss in children and increased risk of cardiovascular diseases, was was eye-opening. Thank you so much for that. Now I want to invite Mr. Jeiel Guarino to present. Thank you, sir.
Thank you, Shipra, and good morning to everyone. I am Jeiel Guarino, and I'm the Global Lead Paint Elimination Campaigner from IPEN, and today I will be discussing how a Rotterdam listing of lead chromates can accelerate global lead paint elimination. So to start with, why lead paint? Um, WHO, as recent as 2020, says that lead paint is one of the largest sources of domestic exposure to lead among children. And as of June 2024, only 48% of countries around the world, according to WHO, has legally binding laws on lead in paint, including India. So this presentation covers how a Rotterdam Convention listing shifts the responsibility for preventing unwanted imports of lead chromates and paints that contain them onto the exporting countries, and how a Rotterdam Convention listing will make it easier for more countries, 52% more of them, to adopt controls in the lead content of paints. Next slide. IPEN is a network of over 600 NGOs now in more than 127 countries, and we have been working to promote lead paint elimination in low and middle income countries since 2007. And my colleague Satish explained earlier, and their organization Toxics Link started the work. So congratulations and kudos to them. Initiatives by governments and these NGOs has led to the adoption of new lead paint regulations in several countries, and IPEN has worked with at least 32 countries to have lead paint regulations, legally binding ones, since 2007. As I've said, our affiliated NGOs are also working on encouraging their governments to nominate lead chromates for a Rotterdam Convention listing. And as of April 2024, the government of Cameroon has already submitted a nomination to the Rotterdam Convention Secretariat listing lead chromates, lead sulfochromate yellow, and lead molybdate red. Next slide, please. The Rotterdam Convention is an international treaty that operates a legally binding prior informed consent procedure, or PIC procedure, which applies to the international trade in the hazardous chemicals listed in its Annex 3. The lead paint control regulations that many countries like India, which legally binding adopted in 2016, impose severe restrictions on the use of lead chromates as pigments, as ingredients in paints. And these pigments are the predominant source of lead in paints, although there are also some other lead compounds that are used in the manufacture of paints, like lead dryers and other additives. Countries that recently adopted lead paint regulations can submit notifications to the Rotterdam Convention Secretariat and nominate the lead chromates for a convention listing. And then a decision by the Rotterdam Convention through the Conference of the Parties to list lead chromates can help greatly accelerate the global elimination of lead paints. Next slide, please. Those countries interested in submitting notifications may wish to review two documents that IPEN has already produced to better explain the listing process and its impact. Now, some of them are already in our website, and I will provide the link later on in this presentation. Next slide, please. So to start with, the lead paint elimination initially garnered international support. For example, representatives of governments attending the 2002 Johannesburg World Summit on Sustainable Development agreed on the need for a phase-out for all lead-based paints. The 2009 International Conference on Chemicals Management II requested that UNEP and WHO establish a partnership to promote the global phase-out of lead in paints. And this has been the Global Alliance to Eliminate Lead Paint, which is also now known as the Lead Paint Alliance. And IPEN sits as at the Advisory Council of the Global Alliance to Eliminate Lead Paint. The United Nations Environment, can you go back? Yes. The United Nations Environment Assembly and the World Health Assembly both passed resolutions calling upon all governments to establish national controls on lead in paints. Next slide. Now, authoritative international institutions as well as medical professionals call upon all governments to adopt lead paint controls because there are already evidences, scientific evidences that prove lead paint is a widespread source of exposure to lead, especially among children, among pregnant women, and among workers. There is still no safe level of lead exposure. Even the blood lead reference values of the US CDC has gone down to 3.5 micrograms per deciliter a couple of years back. Exposure to even small amounts of lead from lead paint can harm a child's health, and this was discussed a while ago by our two previous speakers, including the child's mental capabilities and the society as a whole. And good cost-effective alternatives are available for all the leaded ingredients used in the manufacture of paints. Next slide, please. Despite support for lead paint elimination, many governments, including those in some countries that already took regulatory action, still find it difficult to effectively control lead in paints. As discussed by my colleague Satish earlier, monitoring and compliance in India remains a problem despite the 2016 regulation. That why? Because the main reasons were imported lead chromate pigments remain easily available and unrestricted, and they are continually traded, especially into low and middle income countries. And some paint manufacturers continue to purchase lead chromate pigments because they are available, and they still use this even with a regulation in place. And we have seen this in countries like mine, the Philippines. Some paint vendors import and then sell lead paints, even in some countries where doing so is unlawful. And in the Philippines, for example, we have seen a lot of imported paints, imported spray paints that are still highly leaded to the tune of 10,000 ppm, even 100,000 ppm, even though we already have a regulation adopted in 2013. Next slide, please. If lead chromates are listed, the convention will ask the World Customs Organization to assign a unique customs code to lead chromates and paints that contain them. And this will allow governments of exporting countries to oblige their exporters and the paint exporters to affix this customs code to their shipping documents. Thereby, custom officials in both exporting and importing countries will be able to identify any unwanted imports. And anyone who wishes will be able to track international trade of lead chromates and paints that contain them. Next slide. Again, once lead chromates are listed, the convention's PIC procedure will place responsibility for preventing unwanted imports of lead chromates and the paints that contain them on the exporting countries. The exporters and custom officials of the exporting countries will become responsible for preventing unwanted imports, and this will reduce the regulatory burden on the importing country. Both countries, whether they have regulations in place or none at all. And therefore, governments will find it easier to monitor, control the manufacture and import of paints that contain lead chromates because the primary regulatory responsibility, can you go back to the previous slide? Yes, the primary regulatory responsibility will be shifted to authorities in the exporting countries. Next slide, please. Based on our research, only a handful of countries produce lead chromates, and in most low and middle income countries, paint manufacturers must import the lead chromate pigments they use in paints that they produce. If the government denies import consent to lead chromates and to paints that contain them, this will by itself effectively remove all paints that contain lead chromates from the domestic market. And because lead chromates are the predominant source of lead in paints, they will remove most lead paints from the domestic market as well. Next slide, please. If the Rotterdam Convention, through its Conference of the Parties, agrees to list lead chromates, it will become much easier for a government that has not yet adopted any national controls on lead in paints to begin doing so. And the convention of the parties will also require 9 months for the governments to evaluate and decide whether and or under what conditions the party will give its consent to future imports of lead chromates and of paints that contain lead chromates. So they can, for example, agree to the importation of lead chromates used in other industries, but disagree or disallow the importation of lead chromates used in paint manufacturing. Next slide, please. Once lead chromates are listed, each convention party will be required to decide whether it consents to imports of lead chromates and the paints that contain them. As I've said earlier, the convention of the parties will appoint a Rotterdam Convention designated national authority, or the DNA, who has the responsibility for overseeing national implementation of the convention's provisions. And within 9 months of the listing decision, every party is expected to make a high-level decision about its future imports of lead chromates and of paints that contain them. Next slide, please. So as I've said earlier, the party can state to consent all imports of lead chromates and of paints that contain them. They can also consent to no imports of lead chromates and of paints that contain them. And they can also consent to imports only if certain specified conditions are met. Or they also may need more time to decide. So a Rotterdam Convention listing does not ban or eliminate lead paint or lead chromates, but it allows the importing country to decide whether they will allow all imports, no imports, or only certain uses for import. Next slide, please. So a party's response to a Rotterdam listing has domestic legal implications. For that reason, the response decision usually must be approved at an appropriately high political level. Countries that have not yet adopted lead paint regulatory controls will need to consider whether they wish to continue accepting imports of lead chromates and paints that contain them or not. And most countries can effectively prohibit all production, local production and sales of paints that contain lead chromates by denying import consent to lead chromates and to lead paint that.
Sorry to interrupt
Yes.
you, Mr. Guarino. Could you please wrap it up early?
Okay.
So
Next
please
slide,
stay on
please.
time. Yeah.
So I've said earlier, a country will be able to subject whether they will consent to no import, all import, or not. But a Rotterdam listing will encourage them to have to legislate regulations if they still do not have it. Next slide, please. So this is what I've said earlier. Most of it, the PIC procedure will prevent unwanted imports, but also it will oblige the countries themselves to, in a show of fairness, to stop manufacturing lead paint and exporting lead chromates. Next slide, please. This is also, as I've said, reiterating that it will make the domestic regulatory control even more strong, especially with the aid of a legally binding treaty like the Rotterdam Convention, if lead chromates are listed. Next slide, please. So in summary, these countries can submit notification of their regulatory action to severely restrict lead chromates to the Rotterdam Convention Secretariat, and thereby nominating it will be able to control the international trade of lead chromates. Next slide. That will be my last slide. So if lead chromates are listed, the convention's provisions will place the issue of whether to control lead in paints on the political agenda of countries that have not yet done so. And the PIC procedure will then greatly reduce the regulatory burden associated with the decision to control lead in paints. And lastly, it will make it easier for them to establish domestic controls if they have not yet done so on lead in paints. Thank you very much.
Thank you, Mr. Guarino, for your presentation. We are inspired by your tireless efforts to protect the health and the environment from the devastating impacts of lead poisoning. Now, I would like to open the floor for a Q&A session. So, who has the first question? Um, so we have a question from Archana Patel for Mr. Sinha. Health policy to support systematic led screening program for children and awareness creation regarding various environmental exposures is lacking since decades in India. We have unfortunately not been able to generate that commitment in health and other ministries. So
I think I quite agree to Archana. I think she's been working on this issue of lead. I have known her, and I
okay.
think I also reciprocate the same kind of thoughts that it needs a much serious kind of thinking from the both the Ministry of Environment and the Ministry of Health. I think both these ministries need to come together and look at some of these issues of public health, but these are really serious issues, and it has very long term and economic uh, kind of impacts for the nation. And lead is serious issue, and I think now, after many years that this discussion was happening before, now we have started to talk again about lead. In the last 2 years, I found some conversation emerging on lead, and but we need to understand that this is a silent killer, and it is doing a lot of damage to both the young generation and even the elderly people. And I think the ministry and the regulators must come together to look at a very comprehensive kind of a policy on for children health. I just same comments. I don't have anything much to add to what Archana Patel is saying. I don't know the reasons for it not happening. It'll be very hard for me to comment on that as to what the reasons are. But there are different kinds of challenges that is there in coming up with a policy, which we found in the case of lead also in paints. We had to work for 10 years from 2006 to 2016 and kept giving details of how contaminated the lead paint is or the paint household paint is, and what is the kind of dust that children are actually putting in the mouth in the homes. So this data was available, this information was available. Even the pediatrician and the doctors knew about it across the country, but it took us a very long time for just a regulation on lead paints to happen. So, looking at a comprehensive policy requires much more work. Thank you.
Mr. Sinha, I think I would slightly disagree because right now our survey and studies have found that doctors and pediatricians, they don't know about lead. Only few of them do, and when they actually are presented with someone with acute exposure to lead, they have in many cases missed out. And also, the facilities for testing blood lead levels are almost non-existent. Even at the highest levels, even the aims across the country, we have found that they are not available. So I think Archana's basic point is right, that I think in our protocols for supporting pregnant women, testing for lead should be compulsory. Right now, we test for other things, including anemia and many other lipid things, but we should be testing for lead as well. Similarly, in the US, when children are admitted to school, they are supposed to be giving certificate on BLL, and that also should be made mandatory. But again, making it mandatory will also need that we have the facilities for doing it, and these facilities are not available. And in the private sector, it's quite expensive, which can't we can't go to scale.
Maybe you're right, but I knew that, like in those days, lead in paints, I think Lal Path Lab had started this test, and there are many
Yeah,
other private labs do it, but government labs, I'm not sure about.
yeah, but it costs about 5,000 rupees, Mr. Sinha.
Yeah, maybe. But there is a cheaper now test available. It's a instant testing that you can do. You get indicated value, and that is I'm forgetting the name. Is available in some of the hospitals. Dr. Venkatesh Tupil has much more details about it. It one prick is like it's like a bloodlet. Sorry, the sugar testing. Uh, that test is also available in many places now.
Um, So we have another question from Ram Charitra Shah. He's from Nepal. What is the contribution of different source of lead exposure in the regional and global BLL studies? I think Mr. John Larsen would answer this question. Well,
Well, that's a very, very important question, and it's an important to know this. But I suspect we don't really know. For example, in Bangladesh, right? In the last few years, it became clear that the lead in turmeric was very high. It's a spice that every household uses, and I think it was the end results in terms of the effect on blood lead levels. Even that is not really clear. Okay, I just talked to Jenna Forthist about this a couple of months ago. She's at Stanford. It was part of this work, but it may have contributed something on the order of maybe half to 1 microgram per DL. Okay, in the population that used turmeric that had lead. Then there is some study on paint. So there's the
ESDU ना देख लिया
yeah. So for example, we don't know how much food is contributing. We don't know how much cookware is contributing. We really don't know how much most of these sources are contributing to blood lead levels. We are about 20 years behind air pollution, PM 2.5, source apportionment studies. There are plenty of them. Even there, it takes time and understanding, and it was still incomplete picture, right? And there are arguments about how much each sector contribute. We are way behind because it has been a forgotten topic for the last 20 years. Since lead was phased out of gasoline, it went completely on the back burner. One thought, okay, we have solved the problem, but it's clear we have not solved the problem. So I will say a lot of work is needed to understand how each source is contributing. Even for paint, it's not clear how much leaded paint is contributing. It varies from house to house, the age of the paint, the chipping, etc., the age of the child. There's so many factors. It's just no simple answer to these things. But very, very clear that we have interventions that can help us reduce blood lead levels. As I presented, this new cost-benefit analysis we've been working on over the last year indicate that there are interventions to reduce. And if any single intervention can reduce blood lead levels by, let's say, 1/4 of a microgram per DL or a half, it's actually great. It's actually very, very good if a single intervention can provide that much reduction, because we know there are many interventions that can be implemented.
You're mute. Shipra, you're on mute.
Okay, sorry, sir. As we are running behind the schedule, so I need to be strict on time, and we'll only consider one question from Maliha Hoke. She's from Bangladesh, ESTO. Thanks for such insightful session. Different research organizations have found lead in foodware and toys, and we are doing campaigns to make the masses aware. But when people buy these products, how will they identify which foodware contains lead? In the case paint, these are labels, but most of the other products don't carry labels. So how generate people will identify while buying these products? Whoever wants to answer.
So, Malia, it's impossible for lay people to identify this. It takes time, it takes resources through XRF. So, here, the role of regulatory bodies come into play, that they should ensure through their regulations that anything coming to the market is following the standards which have been set. There have been standards set for paints, there have been standards set for different kind of food products, and they need to enforce it. So it's like saying that many of the food products may contain some sort of say pesticides or any other poisonous elements, and that is where the role of government and role of a regulatory body comes in.
Shipra, I can also
Yeah.
add something.
Yes, sir. Please.
Yeah, based on IPEN's research over the years, we usually, and based on lead paint as well, what tip I can give you, Malia, is that you can avoid painted foodware and painted toys, especially those painted in bright colors such as yellow, orange, red, green, possibly violet, because they may contain the lead chromates, the lead sulfochromate yellow, and the lead molybdate sulfate red that I discussed a while ago. Thank you.
Yeah, if I also may just make a small contribution to this. Uh, this is, of course, a very, very good question. It's about what can we as individuals do, as consumers do, as individuals in society. Uh, of course, in the meantime, while before this is all addressed and sorted out, there are some things one can do. For example, there are studies that suggest, let's say, for example, if you're concerned that your food is contaminated with lead, what can you do? Something you can do, for example, rice, you can boil it for 5 minutes, and then you pour out the water and you put new water. Some studies have shown that that reduces lead in food by 30%. So that's, for example, one thing you can do if you suspect or if you're concerned, if you're worried that this is an issue. You could probably do the same with vegetables as well, depending upon how you cook your food, right? But at least the rice. You can take measures to protect your child. Make sure your child don't end up or is iron deficient, okay? Don't make sure your young child is not suffering from iron deficiency anemia, because children with anemia or iron deficiency seems like they absorb more of the lead that they take in than other children. If your child maybe suffer from stunting, do the same thing. Be careful, nutrition. Make sure you get enough nutrition. That may help the child. If you are concerned about the cookware, well, maybe you would want to change your cookware to maybe stainless steel or some other thing that is less likely to be contaminated. Yes, these have some cost, of course. Not everybody can afford these actions, especially if there's just this uncertainty whether it's even a problem. But there's some things we can do in the meantime. And I would also say, yes, toys, anything that are the colors, make sure young children develop good hand washing habits, right? After playing with things that has all these colors, make sure children wash their hands, especially before they start eating. Make sure mothers wash their hands. That can also help reduce. Also, it reduce intake maybe through dust, soil children get on their hands. Implement good hand washing practices more often than less often. That may also help them.
Again, you are
I
on
think
mute,
you're on
Shipra.
mute.
I can't hear you.
So now we are end with the session. So I want to thank everyone and the chair and the panelist and the speaker and all the audience. I want to give the stage to Dr. Indu Bhushan to give the closing remarks.
So thank you very much, Shipra, and thank you very much, Asia, for organizing this. I'll not take too much time because we are already have exceeded the time. But all three panelists actually provided something very, at least to me, it was something new, and they enlightened us more with their insights and research. Mr. Sinha very clearly brought out that while we have very strong standards for paints and, of course, for other things, but implementation is the key, and where implementation is needed, because while formal sector may be following those standards, informal sector where poor people go, and so they are not following the standards, or many of them are not following the standards. Professor Larsen, of course, shared with us a lot of other very insightful things. And what I took away from him was that while we knew about the impact of lead on IQ and cardiovascular diseases, now the new research is saying that actually we were slightly misled. The impact is even more than what we thought earlier. And he also shared that impact is okay, and we know that level of blood lead is very high, but we need to focus on how to address it. And for doing that, we need to focus on where this exposure is coming from. And there are many sources of lead exposure, but all those sources may not be the most effective sources, because some of them actually may be doing more harm, which are going to through mouth. And I think his observation that when you look at a community, you would find that not every household has equal level of exposure. That shows that while the environment factors are important and creating that exposure, but individual factors, family level factors are also important. And there are many areas of research that we have for understanding the whole dynamics more. But one of them is to looking at the role of cookware, and especially the aluminum cookware on lead. And I think we should be doing more on that. But again, Mr. Guarino also presented to us that while we've done well as an international community in terms of banning paints, lead in paints, but we need to do more on lead chromates. And a similar kind of work that we had done on banning leaded paints has to be done for export and production of lead chromate, and because that is being used right now by informal sector. But I know that in India we have found that lead chromate is also used for adulteration with turmeric, because it makes it more brighter and it increases the weight. So I think using lead chromate or having a better regulation on production and distribution and export and import of lead chromate would be important, and that should be looked at. So with that, I want to thank all the panelists. I want to thank Asia and Shipra for doing moderating this very skillfully. And I look forward to the next session, which will be in about 5 hours, right? Thank you.
Yes, sir.
Thank you.
Thank you, sir. Thank you for chairing the session. Lastly, I want to thank all for braving the elements to attend today. I know it's a busy time, and so I appreciate you making the efforts to be here. I'm confident that our discussions today will help shape a stronger policy framework and research agenda for addressing lead poisoning in South Asia. Okay. All the best, everyone. I hope you all will join us in the second session. Thank you.